Hi, Dr. Gary Frenette here. And as you recall, you've already seen, I believe, the first chemotherapy video which we would recommend, and that's a general chemotherapy video. In that video, we talk about some of the commonalities that all treatments share and how you can anticipate and react to some of the potential issues you might face. However, as we mentioned, there's about 75 different medicines that we call chemotherapy. And we now wanted to produce a video speaking to you about the specific medications you'll be taking. In this video, we're going to discuss several issues with regard to that treatment. How do those drugs work? How are those treatments administered? What is the schedule of treatments? And we'll go into some of the potential reactions you could have to that treatment and how you can adjust to them. As always, whenever you have any questions, you should call your healthcare team if there's ever an issue. But by watching these videos, you may be better able to anticipate and prepare for some of the rare side effects that can happen. So as you can see here, we're actually within a chemotherapy treatment room. And we have chemotherapy chairs where you can sit and even lie back. There's TVs and internet access so that you can be entertained. And we'll also allow you to have a family member with you or a friend with you during your treatment. The specific number of treatments and the regulations, such as how old they need to be, will be discussed with you with your healthcare team during your chemotherapy teaching session. These videos, for example, are meant to supplement but not to replace that specific interaction you're going to have with us prior to your treatment, so you'll be able to get all your questions answered. During this video, what we'd recommend, as with the first video, is that you write down any questions you might have about your treatment, and then we can discuss those specifically when you come for your appointment to make your appointment more productive and to make sure all your questions have been appropriately addressed. There are some issues that you might imagine come about when you're getting chemotherapy treatment that I'd just like to discuss briefly. And as you can tell, we're in a large chemotherapy treatment room. That's done on purpose so that the nurses can have visual access to you during your treatment. If there are any unfortunate reactions or problems that you're having, we can recognize those immediately. Because it is an open space though, we usually ask that patients refrain from wearing heavy perfumes or colognes. Although you may not be bothered by them, other people may be more sensitive to smells during that treatment and therefore would appreciate you wearing as little perfume or cologne as possible. Likewise, oftentimes patients will bring snacks or food into the chemotherapy treatment room, which is completely reasonable and appropriate. But we'd ask that they not be especially strong smelling because, once again, some people can develop an aversion to strongly smelling food during their treatment. And so as a courtesy to others, we would ask that you try to respect that during your treatment. In addition to the TV, for example, or computers, a lot of times people like to listen to music or other audible entertainment. Because other people may be trying to rest, it's always a nice idea to bring headphones or something like that into your treatment room so you can enjoy the music or the TV at the volume you like without having to worry about disturbing others. The next portion of the video is going to be a slide presentation of your specific chemotherapy treatment. Make sure you have a notepad with you and jot down any notes or questions you might have or that the slide presentation generates so that we can answer them during your in-person visit with us afterwards. This video represents the views of Dr. Gary Frenette and not any clinic or hospital system. It's designed to supplement, but not to replace the written and verbal information provided to you during your teaching sessions. It reviews common trivial side effects as well as rare but life-threatening complications of therapy. Today we're going to talk about a regimen called CMF chemotherapy, which is comprised of 3 drugs, Cytoxan, methotrexate, and 5-fluorouracil, commonly called 5-FU. First, let's talk about how chemotherapy works. And to best understand how chemotherapy works and why we're recommending this treatment, you'll need a brief refresher in biology. Don't worry, we're going to keep it simple. Remember, all living things are made of cells, and the blueprint for how a cell and our bodies are made is encoded in a molecule called deoxyribonucleic acid, otherwise known as DNA. Here's a short video showing this process. So cancerous tumors are characterized by uncontrolled cell division. Both normal and cancerous cells divide by going through something called the cell cycle. The cell cycle goes from resting phase through active growing phases and then to mitosis or cell division. The ability of chemotherapy to kill cancer cells depends to halt cell division. When the cancer cells are unable to divide, they die. Chemotherapy kills cancer cells more effectively than normal cells because the cancer cells divide faster and don't have time to repair themselves. We're going to show now a brief video on the cell cycle itself. So the scheduling of chemotherapy, therefore, is set based on the type of cancer, the rate at which the cancer cells divide, and the time at which a given drug is likely to be effective. That's why chemotherapy is typically given in cycles. Cycles are simply treatments which are spaced out by given time intervals. During this time, the cancer cell is killed while the normal cell has time to heal. When the healing of the normal cell is not completed, side effects occur. The normal cells most commonly affected by chemotherapy include blood cells, the lining of the stomach and the colon, and hair follicles. This accounts for some of the common side effects of chemotherapy, which include low blood counts, mouth sores, nausea, and hair loss. Cyclophosphamide, or Cytoxan, is an alkylating agent, and it works by cross-linking DNA and not allowing it to duplicate. If the cancer cell cannot duplicate its DNA, it dies. Normal cells, however, have higher amounts of an enzyme that renders the drug inactive and are therefore less affected by the drug and able to repair any DNA damage done. Methotrexate, like 5-fluorouracil, is what is known as an anti-metabolite drug that mimics an important component for cell division. Methotrexate inhibits a protein called DHFR, which is important for production of the building blocks of DNA. By inhibiting this enzyme, the cancer cells are unable to survive. The more slowly dividing normal cells, however, can overcome this inhibition and survive treatment. 5-FU also belongs to a class of drugs called antimetabolites. 5-FU is similar to molecules used for DNA and RNA synthesis. When the 5-FU molecule is mistaken for its normal counterpart by the cancer cell, it causes the cell to die. 5-FU therefore only works when the cell is duplicating its DNA and RNA, and therefore is most effective when given slowly over a longer period of time, that is, by continuous infusion. All three drugs, Cytoxan, methotrexate, and 5-FU, are given intravenously or by vein every 21 days for 8 treatments. Anti-nausea medications are given prior to administration of CMF chemotherapy. The CMF regimen takes about 2 or 3 hours to administer. Growth factors such as Neupogen or Neulasta may be given under the skin, that is subcutaneously, to help your white cells or immune system recover. This graph shows the schedule of 5-FU. The chemotherapy is all given in the course of 1 day. Unlike some regimens, the 5-FU in this regimen is given in a short treatment rather than a continuous infusion. Once again, medications to support your blood cells called Neupogen may be given later in the 21-day cycle. So the drugs are given every 3 weeks, and the number of cycles varies, but often 8 treatments are given, and therefore you would receive treatment over 3 times 8, or 24 weeks. Let's talk about some of the side effects of CMF chemotherapy. But first, please remember that each person's reaction to chemotherapy is different. Some people have very few side effects, while others may experience more. The side effects described here won't affect everyone who has CMF chemotherapy. Heartburn is a common reaction to treatment. This often feels like a pit in the stomach or even nausea. It's important to recognize when you might have this because it can be treated with medications that block acid suppression, such as Pepcid. Also, constipation or diarrhea can occur. Diarrhea is the more common side effect here and can be treated by eating soluble fiber or the brat diet, which consists of banana, rice, applesauce, or toast, or antidiarrheal medicines themselves. Mouth sores, as well as nasal tenderness, can occur. Rinse your mouth frequently with salt water and non-alcoholic mouthwash. Mouthwash that numbs the lining of the mouth can be used if ulcer or pain develops. Blood counts, especially white cells that help you fight infection, are reduced with this regimen. This usually occurs 5 to 7 days after treatment is given. You should report any fever greater than 100.5 or shaking chill to your healthcare team. You may be given shots to help promote recovery of your immune system. Nausea is usually mild with this regimen and occurs 6 hours to 48 hours after treatment. You'll be given anti-nausea medications before your treatment by vein and by mouth as needed thereafter. Bladder irritation can occur with Cytoxan, but usually at higher doses than those given in this treatment. Good fluid intake after chemotherapy should help avoid this. Hair loss is not generally dramatic or cosmetically noticeable with this regimen, but of course that can vary. Your hair will grow at a normal rate after treatment, but may at first have a different color or texture. The cost of your wig may be covered by insurance. Watery or itchy eyes can also occur with CMF chemotherapy. This usually responds to lubricating eye drops. CMF chemotherapy can affect fertility, so talk to your healthcare team if this is an issue for you. During chemotherapy, you should practice adequate contraception. As we mentioned, you're going to receive one or more medications by vein prior to your chemotherapy. You'll also receive, however, prescriptions for medications you can take by mouth as needed once you get home. If you experience nausea, take these medications and don't wait for it simply to pass on its own. Since these medications can cause constipation, you may need Miralax or another mild laxative to help you over that problem. Some of the medications you may receive by prescription include Zofran or ondansetron. You should take one 8 mg tablet every 8 hours as needed for nausea. This is a medication that doesn't really cause drowsiness, so it can be a good choice during the day. Phenergan or promethazine can also be taken, one tablet every 6 hours as needed. These medications can cause drowsiness, which varies between different individuals. Lastly, Ativan or lorazepam usually does cause sedation, and therefore that can be a good choice to take at night when you're trying to get to bed. Let's go over some of the frequently asked questions with regard to CMF chemotherapy. Can I drive to my chemotherapy treatments? Well, we'd like you to have a driver for your first treatment in case there's any unexpected side effects. Also, if you receive drugs such as antihistamines that cause sedation, you may need a driver even for subsequent therapies. Will I gain weight with steroids or dexamethasone? These drugs can cause fluid retention and increased appetite in some patients. Be aware of your food intake as well as the quality of the food you're eating. For example, avoid excessive desserts or salts or simple carbohydrates. Can I get manicures, pedicures, or massage? Manicures and pedicures are usually avoided during aggressive chemotherapy. If you're receiving chemotherapy chronically, it may be possible to have manicures or pedicures, but you may want to bring your own tools and avoid cutting cuticles. Avoid skin scrubs if you have skin sensitivity on the palms or soles also. Massage therapy, however, is usually very helpful during treatment, but avoid deep muscle massage if your platelets are low. Remember, platelets are the cells in your blood that help your blood clot. Are there any food restrictions? Well, avoid uncooked fish, meat, or eggs. There are no restrictions, however, regarding fresh fruit and vegetables. Simply wash them as you normally would before eating them. You may find that you prefer cooler, lighter foods and meals during treatment also. Smoothies, especially those with protein supplements, can also be a healthy, attractive food choice, as can Greek yogurt. Can I exercise during chemotherapy? Absolutely, and we strongly recommend that you do so in order to maintain your strength and endurance during treatment. You should pace yourself, especially on your slow days, and simply stop when you become fatigued. Should I change my diet to avoid cancer in the future? Well, we'll discuss dietary changes, but you may find that only certain foods appeal to you during treatment and that your sense of taste has changed. Therefore, start slowly with any dietary changes and simply focus on healthy, non-processed foods as a good start. Should I take anti-nausea medications at home after my treatment? Well, as we've just discussed, that may be necessary or recommended, and we'll review those issues with you during your visit with us. Can I take my regular medications? Unless you're informed otherwise, continue your current medications as prescribed by your physicians. Should I take vitamins or supplements? Well, there can be significant interactions between supplements or vitamins and chemotherapy drugs. Please assemble a list of all the supplements and vitamins you're taking. In general, we strongly prefer that these be stopped until after your chemotherapy to avoid any unforeseen side effects or potential interactions. These can usually be safely resumed, however, after therapy is completed. Do I need a port or an intravascular access device? Although we can usually treat intravenously by simply inserting an IV catheter in the arm, ports may be required for continuous infusions of drugs, or when there's poor or limited venous access, or when the drugs are irritating to the veins. We're going to show a brief video at the end of this video to provide an overview of ports for chemotherapy administration. So in summary, chemotherapy is an effective medication because there's a therapeutic window. In other words, the chemotherapy drugs are specifically designed to be toxic to the cancer cells, while your normal cells have the ability to recover from this treatment and regrow normally. The chemotherapy treatment and supportive medications such as anti-nausea medications and shots to help your immune system are delivered at specific times during each treatment or cycle. The side effects from chemotherapy are generally mild, self-limited, and managed with medications or behavioral changes. Severe side effects are very rare. Most importantly, if you have any questions or concerns regarding your therapy or the symptoms you're experiencing, please call your healthcare team. That's really what we're here for. Well, I want to thank you for watching the second video today, and I hope you've written down all your questions so that we can address them during a personal visit with your healthcare team, what we call a chemotherapy teaching session prior to your therapy. That way, I'm very confident that you're going to be comfortable with your treatment and be able to anticipate any issues that arise. As always, however, if something unexpected happens, I want you to feel very free to call us at any time for any reason so that we can address any concerns you might have. My friend and colleague, Dr. Eric Wang, is now going to briefly discuss the use of venous access devices, or portacasts as we sometimes call them, in the use of chemotherapy. Not everyone who receives chemotherapy needs a portacath, but for example, those patients with poor access to veins in their arm, or patients who require continuous infusions of chemotherapy over 1 to 2 days, will be benefited by the use of these ports. With these ports, you can swim, you can shower, and perform other activities as he'll now discuss for you. So move ahead to the next section of the video if you think you may want to learn more about these devices, or if you believe you're a candidate for these.
Welcome. I'm Dr. Eric Wang, interventional radiologist with the Vascular and Interventional Specialists of Charlotte Radiology. Your healthcare provider has ordered a port placement for you. I'm here to review this procedure and to make you and your family members feel at ease. A port is a small device used to obtain safe and reliable access to administer IV medications, such as chemotherapy drugs or antibiotics, and also used to obtain blood samples. Port is a small device, as I mentioned, and is about the width of a quarter and less than ½ an inch thick. The port is implanted underneath the skin surface at the chest, a few centimeters below the collarbone, and this tubing is then inserted into a neck vein. Most patients are relieved after they have had their port placed that they no longer have to be stuck multiple times in their arms to get IV access. The port, once healed, is relatively unnoticeable and requires very little care. Patients resume their normal daily activities. This can include taking baths, exercise, and even swimming without worrying about the port. During your port placement, you will be taken to an interventional radiology suite, where sophisticated X-ray equipment will be used for safe placement of your port. A technologist will then use special soap to wash the upper chest and neck, and then a sterile drape will be placed over the skin surface in order to provide a sterile environment to decrease the risk of infection. Once you are prepped, the nurse will give you sedation through an IV, and I will give you local numbing medication at the skin access site. A small pocket is created at the upper chest level, and then a catheter is placed under lifetime X-ray guidance into a neck vein. Once the port is placed, the pocket will be closed in a couple layers of absorbable suture, which will heal on its own. You will then go to the nursing recovery area and rest for about an hour prior to going home. Thank you for allowing Charlotte Radiology to be your healthcare provider. Please do not hesitate to ask additional questions during your visit.